Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Good morning. This is Kaycie Rathburn with Pharmacy Leaders Podcast. We are at the APhA Institute on Alcoholism and Drug Dependencies in Salt Lake City, Utah. Today, my guest is Callie Downs, who's an attendee of the Institute. Welcome, Callie. Can you tell us a little bit about yourself?
Hi, everyone. My name is Callie Downs. I'm a P3 student at the University of Houston College of Pharmacy. I'm also the Vice President of Patient Care for our APhA ASP chapter and a student representative for Holmes Clinic, which stands for Houston Outreach Medicine Education and Social Services. I know that's a mouthful, but it's basically a student-run clinic for Houston's homeless that operates every Sunday of the year, and it's staffed by pharmacy students and medical students from the schools in the area.
Very cool. So did the homeless clinic, is that what kind of inspired you to come, or why did you come, and what were you hoping to get out of this?
So part of the reason I wanted to attend the Institute was to gain more understanding of addiction as a disease and start to break down the stigmas around addiction. It's something that I think we see all too often in our communities, especially in the homeless community in Houston. And I think it's also something that a lot of healthcare providers like to just glance over instead of tackle head on. So that's pretty much what inspired me to come here.
Okay, and when did you decide that you were going to come? Did anyone play a role into that? Did your school market it at all?
So at the University of Houston, we have a pretty strong Generation RX, and a lot of students have come to the Institute before us, and really the school focused on broadcasting it to students and getting the word out. So I'd say that, the school really helped me identify this opportunity and get started on applying and everything like that.
And what did you hope to do with this information when you get back?
So I think that all of the things that we've learned so far are very readily applicable to the homeless population and the clinic, and also even like when I'm working as an intern at the community pharmacy, I'm hoping to bring all this information back and be able to play a more active role in the opioid crisis and talking to patients and, getting them resources and being more open to having these conversations with patients and things like that. So I think that I'm definitely learning a lot here so far.
Can you expand more on what kind of resources you're talking about, like that you would refer them to?
Yeah, so we've learned a lot so far about, all the different group meetings. So AA, and then there's Al-Anon, which is for family members of those suffering from substance abuse disorders. Also things like Narcotics Anonymous. These are all things that I knew existed somewhere, but not quite how they worked, or things like that. So those would be really useful resources for patients, I think.
You also touched on kind of just like this would make it easier to talk to patients when, they bring in prescriptions for controls. Can you expand a little bit more on that? Did you learn anything new about how you could counsel under the, direction of a pharmacist?
Yeah, so today we talked about, what do you do when a patient comes in for an early refill, or, if you get a fraudulent prescription, is that you need to be firm in your response and, just say, no, it's not safe for me to refill this medication early. It's not allowed. And, as healthcare providers, our number one goal is to first do no harm. So I think it's really important that, we're staying true to that and holding our ground when we see patients that are bringing in fraudulent prescriptions or things like that. I think you also have to keep in mind, your personal safety. Some situations are obviously more dangerous than others, and you need to be able to kind of identify the situation and keep yourself safe as well as the patients.
Right. And then also, I think they also, kind of talked about just how you can also say no without ruining the relationship, or
Yeah.
how to get them other help, like you mentioned before. So where do you see the greatest need in your communities? I know you touched on the homeless population. Do you think that in Houston that is the largest area that's needed, or do you see it other places too?
Well, I think that in my personal experience, that the homeless population is who I see most frequently being affected by addiction. But that's mainly because that's the population that I work with the most. But I definitely see it in, like, I've worked in inner city community pharmacies, and, you know, there are a lot of patients that exhibit drug-seeking behavior or will openly admit to you that they're using some sort of substance, whether it be opioids, heroin, cocaine, anything like that. And I think it's important that we don't discount any of those other drugs as well as opioids. So I think, like, especially inner city Houston and the homeless population are where I see it the most. But the opioid crisis knows no bounds, you know.
Right.
It's going to be everywhere. It's in rural pharmacies. It's in inner cities. It's across America.
Right. So why do you think it's so important that we're here and we're getting educated more on this?
I think it's really important because at the end of the day, people are dying. Mm-hmm. You know, there's not, it's not something we can just brush under the rug anymore. And as a student pharmacist and as a future professional, I think it's really important that we stay up to date on all topics healthcare related. You know, we play an important role in this scheme of opioids and, you know, for a lot of patients, access and things like that. So we're kind of, I think sometimes we act as like the gatekeeper. And so I think we have a really important role. So, you know, as someone who practices in the community or even in the hospital, wherever you practice in pharmacy, it's important that you're educated about all facets of this disease.
Do you think that, you know, being educated like this will change the way that you approach, you know, being representative or an officer in APHA, of just like educating your peers and, you know, helping people through difficult situations that they might not have encountered yet and different things, even like working with practicing pharmacists?
Oh, I think so, for sure. You know, all the things I've learned here, I'm excited to take back to our chapter at APHA ASP in Houston and, you know, talk to students about how do we start difficult conversations and, you know, how do we approach these situations, because in our curriculum, you know, they don't have time to, you know, flesh out all the details of what do you do with a fraudulent prescription other than kind of glossing over it. Mm-hmm. So I think that I'm really excited to get back and talk to my peers about what we've learned so far, because like I said, you know, it's important information, and we're all about to go on, all the P3s are about to go on a community pharmacy rotation. So it's definitely time for us to start tackling this.
And do you think this is a beneficial conference for all students? Do you think that, like, right now in your pharmacy career, you're more ready for it than previously, or do you think like it could be a good time for anybody to come?
I think that the information we've been learning so far, I've really enjoyed it. Some of the more pharmacology-oriented things, I feel like I understand more now than I would have in my first year. But that's not to say that, you know, this conference isn't for first-year students. There's a lot of information, and it's all broken down pretty easily. You know, it's targeted towards people who are here to learn, and if you just keep an open mind and be willing to learn, there's nothing that should stop you from coming to Institute. I think it's beneficial for students of any level, really.
Okay, and I know we've touched on this a little bit, but how do you think this experience will impact you and others in the profession just going forward, and maybe more of like how it'll change your future practice?
Yeah, so far we've attended like various AA meetings, or we had an NA meeting, and I think that sitting through those meetings really has been impactful and showed me how hard the 12 steps are to recovery. And I've honestly gained so much more respect for people suffering from addiction and people in recovery. You know, I thought, you know, maybe, and I was probably naive to think this, but, you know, it's so easy to quit. Like, why doesn't everybody, like,
Right.
I don't understand. And now I'm gaining so much more understanding and respect that I think it will really improve my patient relationships going forward, of just being more aware and respectful and empathetic towards their situation and their journey, because
Right.
it's so hard.
Right. Yeah, I do think one of the big things we talk about a lot in pharmacy is empathy. And something like this really brings a whole new level to empathy when you get to attend some of those meetings. I know there's a lot of stigma. I think you even hit a little bit on it of just, you know, why can't you get clean? Do you think that you're learning more to how to break down that stigma and how to carry that out with other people when you encounter stigma?
Yeah, I think definitely stigma is something that, you know, we all encounter every day. I've worked with pharmacists who are very biased towards the substance use disorder population, that say, like, oh, I don't want those druggies in my pharmacy. And, you know, just using words like druggies or crackhead or something like that, even in casual conversation around your peers, that's contributing to the problem. So I think we need to start to change our language. That's something that, you know, has been done in the civil rights movement, in the women's suffrage movement, all those types of things. Well, it's time that we start doing that with addiction and recovery.
Right. I think that's very important too, especially because we can, as a healthcare provider, can be the first line of change for that.
Yeah, definitely.
All right, so to end this, what do you recommend for any students that are even somewhat interested in coming to this institute?
So for any students that are even have an inkling of maybe I should go, I think that you should just do it and take the leap. This conference was something that I had heard of before, and the first time I heard about it, I wasn't quite sure. And then hearing students come back and, you know, testify to their experiences here made me realize that, you know, this is something that I need to do not only for myself to learn and grow, but also for my patients so that I can be a better healthcare provider in the future.
Right, I agree. So that was it for today, but thank you for joining us today, Callie, and sharing your experience. Thank you for Tony and the Pharmacy Leaders Podcast for allowing us to shed light on this important subject that the profession is facing, and I will see you guys in the next episode.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.